Good morning. How are you?
Hey, I'm good. How are you?
I'm good. Thank you so much for being on with me today. I appreciate you taking the time from your extraordinarily busy schedule, I'm sure.
Oh, I've never been busier. This has been like the busiest 3 weeks. I think it's more of a mental exhaustion than anything else.
For sure. So I want to introduce you for people watching who may not know you. My friend with me today is Ashlee Collins. She is the marketing coordinator for Southwest Healthcare System, and they oversee Rancho Springs and Inland Valley Medical Center here in our area, Temecula or Murrieta, I guess.
Yeah, Muriel and Waldemar.
Yes, Murrieta Wildemar. And I just wanted to have you on here. I think you are a great resource for people right now to kind of learn a little bit what's going on inside the hospitals.
Yeah.
So what's new?
Oh my goodness.
What question?
Yeah, it's crazy.
I'm sure.
I see everybody, working from home, and it's still kind of business as usual over here.
This is my working from home hair.
Yeah. I know. I feel very fortunate to have a place to go to every day.
Yes.
But working in the communication and marketing department, it's constant messaging that we're, pumping out on a daily basis. So a lot of my job now is literally like trolling through Facebook, seeing what the public is saying, what the perception is, what the misinformation is, which is more what I see. And then taking our internal information in the hospital and then creating videos and messaging on that. So we've had a lot of increase in our social media engagement. Obviously, people are turning to the hospital. What's going on?
Yeah.
Visitation policies have obviously changed in the hospital. It's a very unnerving time, especially for our front lines and our staff. They're working very hard.
Yes.
There's some uncertainties, and there's people coming in who are sick and who aren't sick, but it's not to the extent that we're seeing in New York and Italy.
Thank God.
Yeah, thank goodness for that. We are relatively low compared to those things, and we still have moms having babies, and they need to know that it's still safe to have your baby in a hospital. So just kind of coming up with that messaging and trying to reassure our community that the hospital is still here. We're still fully operational. If you're having a stroke or a heart attack, please don't be afraid to come to the hospital.
Please don't. Please go.
Please don't deal with it at home. And that's kind of like what we're seeing. A lot of people who may need medical attention may be afraid to come to the hospital right now. And that is absolutely, please don't do that. If you need medical attention, please come in. We're not full of COVID patients. In fact, a lot of COVID patients are recovering in the comfort of their own home, which is good. They should be doing that and isolating themselves. And I think the community needs to realize that even though we're relatively low, the CDC is still projecting that Riverside County, our movement it's only decreased by 30%, which means 70% of Riverside County is still out and about and moving around. And if you check the numbers,
tisk.
Yeah, tisk people. So it's a good thing we have a mask order. We're for sure, but still, like, stay at home if you don't need to go places. Home Depot is probably busier than ever because everybody's remodeling their home.
For sure, painting those kitchen cabinets.
Yeah, well, exactly. You got to keep yourself busy, and I get it. I'm a very ADD personality, and I have
of course
to do, as I'm sure a lot of people are, and it's hard to sit at home, especially when you have kiddos running everywhere. I can barely handle Saturday and Sunday because my boys are running all over the place.
Yes.
So I get it. I do get it. But for the safety of our community, for sure, it's really going to help us plateau and hopefully start to reduce the number of people getting sick. So
let's get that number lower than 70%, kids.
Yeah, exactly. And it's hard on the staff, because there's all these concerns about our PPEs and masks and are they safe, and are I think it's normal to be nervous, especially when there's a pandemic of a virus that we haven't seen before. But our staff is holding strong, and they're doing good, and we're not PPEs, and they're very well protected, and those patients that do come in, we're equipped to take care of them as we are with anybody else who comes in for a medical emergency. And we totally isolate those patients, and they're under observation, and you're not around any of them. Like I haven't been around any of them. I don't even go to the hospital anymore, but still. You know, so it's not a scary place in the hospital. It's actually because of visitation, there's a lot less traffic. Even that I'm in the administrative building, and it's on lockdown. You can't come in unless you can badge in. And we have to check in every day. We have to have our temperatures taken and make sure that nobody's traveled anywhere. And everybody has to check in kind of at the front location. There are no visitors right now, unfortunately, but that's for the safety of our patients and our staff. But are having a baby upstairs, you can have one partner, and they can stay with you the whole time. Which is good. So any mommies out there like, I'm gonna have my baby alone. No, you won't.
I have heard that too. It has been something that's come up. It's like, I can't have anybody in there, and I'm like, I don't think
no, you
I think
definitely
you can have your partner, but that's it. No grandparents.
I know if I couldn't have my husband, I would be a little leery about that too. But no, you can have your husband. Yesterday I did see a pair of grandparents out in the parking lot, and they were looking up at the window, meeting their new grandbaby through the window. Oh, that sounds really sad and emotional. It's for the protection of that mommy and that baby, and they will be, you know, they will get to meet soon. That was very touching to see that, especially because it was raining yesterday. You know, and then
heartstrings.
You know, we have people that are outside the window visiting their loved ones, but it's for the safety of them and the patient and the staff. So
of course,
really hoping that people will stay home so that this can blow over sooner rather than later. For
sure. My goodness. So I know you mentioned that you weren't out of safety equipment for your staff, but are you guys taking donations, and what are those, and where can we drop them off?
Absolutely. We are taking donations. We have had some community members donating N95 masks or surgical masks or even bunny suits, even cloth masks, the homemade masks. We are taking those. They could either reach out to myself or our Ginny Ince is our Service Excellence Director. They can just call the number for the hospital and ask for Ginny Ince or Ashlee Collins, myself, and we can arrange those donations, because we would love to take pictures with people. I mean,
for sure
involves social media, and I want to tag people. I want to thank people who are doing this for our staff. But we do have a shipping and receiving, and typically we've been meeting them over there, and so they can collect them and keep the inventory.
Awesome.
We've had an overwhelming show of support from the community. It's really awesome to see people come together, people donating food to our staff, lunch and stuff like that. So it's really been wonderful to see the community come together.
We do have an awesome community. Even everyone that I see trying to support the local businesses and get takeout when they can and stuff. It's so sweet.
You know, and even I'm like trying to, who am I gonna go to this week? You know, really trying to help people out, because that's what we need to be doing right now, is helping each other, so that when all this blows over, we can get back on our feet. I mean, I can only imagine the hairstylists and the nail people are gonna.
Oh my gosh!
When all this is over.
They're gonna be booked. Make your appointment now if you can, because they're gonna be booked for months.
I know. I just got my nail stuff from Amazon yesterday, and I gave it a. It's not so bad, but I prefer
that. Terrible.
It's not terrible.
I know. I got my nail design where you can already see a fill line, so the grow out's easier.
Well, I just got the hard gel. If you need the fill, you can borrow it. Because I did it. It's not.
That's so funny. As far as advice to everyone watching is obviously, please try and stay home as much as you can. What else? What other advice do you have for us?
Just make sure you're washing your hands often. If you are going out to the store, obviously you need to wear your masks now. When you're bringing your groceries in, make sure that if it's things that have been touched by other people, you know, fruit, even you know, when you're reaching like for your milk and other people are touching them, it might be better to be kind of cleaning those things off in your garage before you bring them into your house, especially if you have children. Some people are going as radical as completely changing their clothes in the garage. I don't know if it's at that level unless
personal preference.
Yeah, personal preference, no judgment. But you know, if you look at the numbers from Riverside County, there are over 90 cases between Temecula and Murrieta, that we need to start minimizing those numbers. And so wash your hands often, 20 seconds at least, with soap and water. Make sure that you have, if you have antibacterial, you know, either the wipes or the hand sanitizer, use those as often as you can. When you get into your car, when you get out of your car, don't touch your face. Don't be kissing on your babies, which is the hardest thing for me because I want to kiss all over my 3-year-old. Mm-hmm. But it's best if I don't. You know, sometimes I don't even work in the hospital, and my husband like, stay away from me. I'm like, okay, whatever. Rude. I know, rude. He's totally staying 6 feet apart from me. But,
it doesn't count for your own family.
I know, but you know, just taking those precautions. But still go outside, not when it's raining. But you know, ride your bikes with your families. You know, spend time, because some of us don't get to do that. So I'm on the fence about feeling jealous, but feeling lucky.
Yeah.
Because you know, I would like to spend more time with my children. Take this time for what it is. I feel like in a way it's a blessing. For that quality family time, because I've never seen so many families outside.
Me either. I know. I walk Owen and it is just crowded, and I'm so happy.
Yeah, I haven't seen it like that since I was a kid. So
great. Me either. I know.
Yeah, like so let's keep this up, people. You know, so it's nice to see that part of it. But but just try to stay healthy. You know, avoid you know, gatherings where there's multiple people. If you don't have to go to the grocery store, if you're only running there, you know, for one item, can it wait? It probably can. I feel like the best time to go is during the week, because the weekend it's just like, oh my goodness.
Madhouse.
Yeah. So yeah, if you don't have to go, just don't, you know, try to stay as much as you can. Or
plan ahead and do Instacart. I mean, Instacart is like 6 days out, but plan ahead. Maybe you can.
Yeah, exactly. Like this time is but a blip in our timeline. So let's just, let's try to do what we can, because 70% of people, we need to have it the opposite, where only 30% people are going out. So
yes, we need to change those statistics for sure.
Right.
Yeah. Well, thank you so much for being on with me and taking the time. I know I mentioned before, I know that you're so busy with all of the marketing going on with the hospitals, and I just appreciate you taking a few minutes for us.
Yeah, of course.
I will include your contact information in the comments below.
Yeah, that'd be great.
So if people want to reach out to you for donations, they can do that, okay?
Yeah, that would be fabulous. Thank you, Lisa.
All right, thank you. Stay healthy, okay?
You too. Bye, girl.